Hi, I am Dr Bindumenon. I am a neurologist from Apollo Specialty Hospitals, Nellore. Welcome to our stroke prevention campaign where we are addressing one risk factor for stroke every month. March is dedicated to heart disease and stroke. Stroke reasons are multifactorial and of which heart disease is one of them. Heart disease in fact stands second in the etiological factors for stroke, and almost 1/3 of patients who get admitted have a cardiac reason for their stroke. Now, what are the cardiac reasons one should look into and see that, and these risk factors are very well controlled. One is atrial fibrillation or atrial flutter, which is an irregular and fast heartbeat in any person, especially in the elderly, in which they may have palpitations, they can have sweating, and they can be intermittent. They should consult their cardiologist, and they have tests to rule out any of these symptoms, and they will put them on effective medication so that during the irregular and fast heartbeat, the clot from the heart does not reach into the brain. Patients can have valvular heart disease. In our country, rheumatic valvular heart disease, which is very common, and that can lead to blood to clot in the valves, and that can again get dislodged from the heart and go to the brain. So if your doctor has diagnosed you as a valvular heart disease, rheumatic valvular heart disease, kindly consult your cardiology at periodic intervals and see that you are taking your medications regularly. Sometimes after the rheumatic valvular heart disease, patients get mechanical prosthetic valves, and for that the doctor prescribes them blood thinners. So kindly see to it that you consult your cardiologist in time so that your blood test, that is the prothrombin time, is very well regulated, so that again the blood does not clot in one of the valves and does not rush to the brain and produce a brain stroke. Other factors like a coronary artery disease, that is a heart attack, and an ischemic heart disease, that is again an atherosclerosis, that is fat into the blood vessels. What can happen to the heart can happen to the brain. So if you take the medications for the heart well, then you don't need to worry about the brain as well. The other conditions are hypertensive heart disease, in which there is a dilatation of the heart, that is a dilated cardiomyopathy. Sometimes postpartum, after pregnancy also, patients have these dilatation of the heart. There are several other reasons, but these are the more common ones, and it is very, very important that you take care of the heart so that what is good for the heart is also good for the brain. Follow our stroke prevention campaign for regular updates and prevent stroke. Thank you.